This is History of Sexuality in the U.S., Lecture 4E, Part 2, talking about the HIV/AIDS crisis. In the late 70s, a lot of scientists and officials were very hopeful about humanity defeating sexually transmitted infections. A big part of the sexual revolution was that the consequences and stakes of sex were lowered when there were effective treatments for things like syphilis, gonorrhea, and chlamydia. That optimism, though, slammed into the wall of the evolving microbial world in the early 1980s when medical officials recognized that there were clusters of rare cancers and pneumonias known as Kaposi sarcoma cancer and pneumocystis carnii pneumonia that almost never appeared in young or healthy people but were suddenly popping up all over the country. This turned out to be one of the first signs of the epidemic that was bubbling beneath the surface, and it probably entered the country long before the 1980s. The human immunodeficiency virus, which was identified positively in 1984, if left unchecked and untreated, can evolve into the acquired immunodeficiency syndrome, AIDS. And AIDS makes you vulnerable to a variety of opportunistic infections. HIV doesn't kill you on its own. Rather, it destroys your immune system, and other infections quickly can take over and kill you. The government response was very weak and lacking. President Reagan wouldn't even say the word AIDS for many years, and instead it fell to the community. Organizations like Gay Men's Health Crisis was formed before HIV was even positively identified. Gay activists like the Sisters of Perpetual Indulgence invented the concept of safe sex to encourage people to be able to still express themselves sexually despite the possible dangers out there by using barrier methods and other forms of safer sexual encounters. And so there's an example of the very first safe sex manual. So old they didn't even have that term, safe sex, yet. They were calling it fair play because they were trying to come up with a language for this. Another important community response comes out of the AIDS Coalition to Unleash Power. ACT UP is formed in 1987 after years of trying to deal with the impact of the epidemic and trying to serve the people with AIDS who were dying and suffering didn't seem to draw out a strong government response. ACT UP was enormously effective, and within a few years, not just due to their efforts, but importantly, they contributed major to the Ryan White Care Act, as well as the eventual inclusion of people with AIDS in the Americans with Disabilities Act. This is going to allow people to access life-saving drugs that are increasingly being developed. And in the mid-90s, highly active antiretroviral treatment, or HAART, becomes available and turns HIV into a treatable chronic condition. It's not a death sentence anymore. Yet, due to the limited availability of these drugs, the low rate of testing, and the stigma that many people still have around the infection, we know that over 1 million people are still dying every year around the world from this disease. That number peaked around 2006, has come down a little bit. There are about 1 million people in this country who are HIV positive. Most of them can live long, happy, healthy lives, but about 1 in 7 or 1 in 8 people who are HIV positive don't even know. And that's why it's really important that you get tested if you are sexually active. This is an ongoing crisis that we want to understand in historical perspective and in transnational perspective, but we also want to recognize it can hit very close to home. If you're interested in learning more about this, I teach a whole class called AIDS in America in the spring, and I'll do it next spring, WGSS 450, and I can talk all day about this, so I will wrap it up there.